Welcome to my podcast. Today I'm going to do the interview questions that you ask for the candidate who are applying for medicine. I've been doing this for the last 4 years, and I will try to talk through one of the questions today has been done. So it's about measles and the MMR. So as we know, measles is highly contagious viral disease which remain cause of death among young children globally, and despite the availability of safe, effective vaccine, cases still on the rise, especially in the UK, and the last recorded level of nearly 3,000 cases in 2024. And the highest annual number, this is the highest number since 2012. And we know that measles vaccine is incorporated in MMR, which is measles, mumps, rubella. And we know that it has to have like 3 doses. And at least we need like 95% of children to be vaccinated to get the herd immunity. And we know recently that the UK is the worst performer among the nation for uptake of measles, mumps, rubella vaccine. So I'll talk you through what should be answered in regard, and the question asked identify and justify at least 2 ways that could improve the vaccination rate uptake in the UK. So we could talk about incentive. It could be about penalty on financial fine or exclusion from certain activity. It could be through health promotion, education, whether national or local. Could be mandatory vaccination program. Could be improved access, convenience group, drop-in center, ways to also to counter the misinformation, which has been going for some time, which is the anti-vaxxer. And health promotion, consideration for cultural barrier, and tailor communication to the local community. And based off those 2 answers, which can be provided from what I have said, and you need to base your claim with justification about the 4 pillars of ethic, which is, as we all know, the autonomy, beneficence, justice, and non-maleficence. So the answers that I got, it was varied from one candidate to another candidate, and some they were giving some very good points. So I'll try to summarize all of them, and it could help in the way how to answer the main points in regard. So, so what's the barrier for what's the reason for low reuptake of vaccination? As we all know, there is a lot of misinformation, which stemmed from various reasons or from various platforms like the social media, sometimes people when they say it and have certain gossips. Also from this report, which has been written by a doctor before, which then later on has been proven that it's not correct, Andrew Whitefield. And so how can we improve or raise the uptake? So there were different considerations. So for instance, a lot of them emphasized us about education, that we start with youngster and children, which will open their eyes to the pros and cons of vaccination, and increase the level of awareness or understanding, and especially if they are still young, below 16, and not like they're not still in control of their choices. So that's needs to go to the parent, because sometimes it's the parents who have the say. So we need to educate parents themselves and establish a certain campaign to see what's the parent understanding, and understand the impact of the virus if they are not or against MMR. And we need to have like presentation and probably have like posters everywhere, like in the bus I can see sometimes, or in the NSH and hospital, GP, in the schools, because this is the place where student goes every day, because certain parents, they might be working long hours and they have issue to go and learn about this kind of things. So we need to also show them with data and figures about the rise of measles nowadays, though it was at certain stage, it was very low. And we need to show that this vaccine is curable and it's long life, and it will prevent occurrence of measles and its consequences if the virus is not taken. And we need to make sure that it's accessible fairly everywhere in the UK. And some they mentioned about the rural and urban area and city-based. So there's a difference in terms of accessibility and probably knowledge. And so this is one of the things that we need to consider schools as the primary place for education and raising awareness. And also if the child knew about this, he will go to his parent or her parent and discuss this and say, I hear this one, and it's very important that we need to take the vaccine rightly in the time mandated. So, and also about advocating and as I say, advert, and also providing leaflets, small leaflet, talking about measles and the importance of vaccination, and it does goods more than harms. So it's very important. And also they stated about increasing fund in different trusts to counteract inequality and low socioeconomic status, because some people, they are not able to access this, especially from low socioeconomic area or the deprived area. So that's another thing to consider. And also we need to have like meetings. Sometimes some advocated like one-to-one talk with their GP and see why they're against having the vaccine, what's their understanding, and we need to justify our explanation. And some they stated about public health domain and campaign as well, about the importance, and try to provide like a supporting approach rather than coercing parent or for the vaccination. And we need also to explore if there is any religious or faith consideration, because certain community, for instance, they have their own views about vaccination or the materials composed of. Say, for instance, when it comes to the injection or the oral, certain vaccines. So we need to explore that as well. And also some suggested to have certain conferences in school and do like a holistic approach, and also provide leaflet and poster and youth club and certain clubs whereby it can be visible and available. And also in the shopping center as well, in order for everyone to see and read this one, and always talk about and weigh the benefit and risk. And of course, as I say, when you make things clear and consent for that, the parent won't feel that coerced for this. And some they went for stating that it should be emphasized it's very mandatory and should be something imposed on parents, so they don't have the choice to say no. So that's something to consider as well. And And some they stated about also newspaper. Schooling is important because it's gonna reduce the barrier, because children goes every day, and of course there are certain children are home educated, so that's another problem to be considered as well. And we need to emphasize that this virus is contagious and spread quickly, so this is something to be considered in mind as well. And in terms of raising awareness, knowledge, I think that's all what I can tell. So I need now to talk to you about each pillar and how it's aligned with the another thing before I forgot. One of the candidates mentioned that child poster should be friendly, so it's child-friendly advert with colorful and appealing images, whether through the television or media, which can be an important factor for children attention to be to be useful. And yeah, and this is because of the misconception around MMR itself. So when we talk about, for instance, the 4 pillars, so we need to act for the patient best interest, obviously. So we need to tell that this vaccine is very important. It's long life, and it's only 3 doses. So we need to emphasize the importance of that, because the consequences of measles virus can be fatal, can be life-threatening, can be the death rate can be high, and we didn't mention what it could cause, like encephalitis and other problems. So we need to explain this in a thorough, compassionate manner, persuasive way. So, and we leave it for the parent, obviously, and the children to make their informed decision after they have the whole information. And we need to explore what's their thought, what's their understanding about, because there is a lot of misinformation which goes in the internet. There is another guy, I think one of the candidates, who mentioned about creating children website, and should be verified and should be monitored with the right information provided about measles vaccines. So I think that was a nice idea and aligning from one of the ethic pillar. Also, one mentioned about the information can be provided also as a leaflet from the GP and pharmacy as well. Or a nurse who can visit the school or visit homes, especially for home educator, because some parents they teach their children in the home and they don't want to go to school. So it's existing, this one. I didn't know about it before, but I knew about it recently for the last couple of years. So yeah, and the other one is not causing harm. So we can explain to them because you know, some children, they might be scary and have needle phobia. So we could explain that it's just a small brick that won't cause any problem, and anyway, I mean the benefit versus risk. For instance, they might experience some tenderness, pain in the area, or slight fever, or feeling sick for a few days. Like I remember when I took the COVID, it made me my hand was really sore. I was feeling under the weather, and I wasn't feeling well. I had slight fever, but it's not that major. So this is another thing. We need to explore with them what's their understanding. Some they might think this is linked to autism, because there's a lot of cases, and a lot of people, they have this kind of understanding that this vaccine causes autism. So we need to rule out that and explain that autism is a different entity and it has nothing to do with MMR, and see the both pros and cons, and those children who have the capacity to understand and retain information, then regurgitate back to you, so as to have the Gallup competency. So they have the access to the right information, they can decide and weigh side effects and versus the benefit. And it should be also aligned with justice, whereby equal access with good understanding and accessibility, and stress about the source and its availability and accessibility. And the other one, as I say, the autonomy, it's their own choice to decide after having all information needed to decide. So once they have the whole information and all query has been ruled out, they can make the informed decision based on that. And as I say, whether the parent or the children they can make their informed decision. Also, in the religious aspect, we need to understand. Some they think that it might not match their faith, so we need to see where it's come from, what's the reasoning, and try to explain in a clear, understandable, simple language, in order for them to make the decision. Also, some they stated about those who are under 16, they shouldn't access to the internet freely. So this is aligning with Australia. So there will be like banning certain sites and misinformation, and some sort of monitoring and verification for those sites. And some they stated like the case for organ donation. They can opt in or opt out, and they have the final say, and it's their own choice without coercion. And also, what else should I say? Some they stated that which is aligning with justice, that there should be no discrimination, whether it stemmed from race, sex, gender, identity. So all of they should access this based on their understanding and the way how information was delivered. And we need to have like signage for certain areas like GP, hospital, schooling, clubs, promotion, primary care, and increase the understanding in order to avoid misconception and encourage access to all with the rights for the autonomy and making good rather than harm, and act for always the best of the interests of the patient or the children, and act fairly. Only two candidates, they stated that it should be compulsory without any right for their autonomy. So that's interesting to know. However, we know that most of the patients, they should understand in order to be willingly take the proposed or explaining the importance of the vaccine in order to not risk catching the virus, because it can spread quite quickly, especially between children or in crowded places. So education is a must in order to make the right decision with respect to their autonomy without coercion or pressuring children or their parents. And not correct, and provide a campaign which to crack down any misinformation. Because I remember in certain parks there's those people who are anti-vaxxer, and they are all the time there in the weekend, whereby they target a lot of people to tell them, don't go for that, don't believe this. There is nothing wrong if you didn't take it, and they will talk about things which, of course, make the public hesitant to go for the vaccine. And some of the, of course, parents will lose trust in the such our doctor. And somebody stated that we need to increase the manufacture of the vaccine and make it available everywhere, which is aligned with accessibility and fairness and justice, of course. And it's down to the parent to decide whether to go for this or that without any feeling the pressure to go for the vaccination. So I hope by that I give you like an overview about all what you can say in regard this case station, and in terms of the four pillars of the ethic or medical ethic, how measles vaccine or MMR is important and shouldn't be missed or ignored. Thank you. Let me know in the comment down below what's your thought. Thank you.